Welcome back Sunbro. We hope you all in great health and great money. Today we are going to talk about hypertension can also occur in children. Here is how to handle it. You are mistaken if you believe that hypertension, also known as high blood pressure, is an adult disease. In actuality, children can also develop hypertension. In fact, the incidence of hypertension in youngsters has been rising significantly, according to data from the Indonesian Pediatrician Association. What causes pediatric hypertension? In the past, adults and the elderly were more likely to have hypertension. However, a survey of 15,000 teenagers revealed that 1 in 5 of them had hypertension. Children's normal blood pressure varies according to their age, gender, and height. In general, children's blood pressure falls into the following categories. Normal blood pressure, less than the 90th percentile. Prehypertension, 90 to 95th percentile or more than 120 per 80 mm hydrogram. Stage 1 hypertension, 95 to 99th percentile plus 5 mm hydrogram. Stage 2 hypertension, greater than the 99th percentile plus 5 mm hydrogram. Children and adults both commonly experience hypertension for the same reasons. Children aged 6 and older may be more susceptible to developing high blood pressure for the following reasons: obesity or being overweight, malnutrition, insufficient exercise, improper diet. Children with high blood pressure who are younger than 6 years old are typically affected by additional illnesses such as heart defects, kidney disease, genetic issues, or hormonal problems. This is known as secondary hypertension. Despite the fact that children with hypertension typically do not have heart attacks or strokes, the danger still exists. Children who have experienced hypertension since infancy have a high likelihood of continuing throughout adulthood. Therefore, to reduce the possibility of complications that affect the child's health, be aware of this problem from the beginning and treat it as soon as you can. What are the signs of child hypertension? Adult hypertension commonly goes undiagnosed since its symptoms are frequently invisible. The same is true with child hypertension. Only a sphygmomanometer can be used to measure blood pressure and determine if it is high or low. However, you must exercise caution if your child begins to show symptoms like headache, seizures, vomit, chest pain, heart palpitations or a rapid heartbeat, difficult to breathe. These symptoms indicate a hypertensive crisis that needs immediate assistance rather than early hypertension symptoms. In regards to grade 2 hypertension in newborns, this condition is typically characterized by the baby vomiting, being unable to properly breastfeed, and being restless. Unfortunately, these symptoms are occasionally identified as signals of stunted growth. You should start checking your child's blood pressure at age 3 if there is a family history of high blood pressure. The same applies if the infant was born too soon, had a low birth weight (LBW), had a congenital heart condition, or experienced specific kidney issues. Since these factors can make people more likely to have high blood pressure, it is important to monitor blood pressure starting in infancy. Managing childhood hypertension. Making healthy lifestyle changes is the most crucial treatment for hypertension in children, just like it is in adults. Blood pressure can be lowered mostly by eating healthy foods, such as more fruits and vegetables, and by engaging in regular activity, such as aerobics or one of your child's favorite sports. One of the things that causes high blood pressure is salt. Nutritionists typically advise families to consume less sodium in the diets. Additionally, you should cut back on the use of canned and boxed meals and switch to consuming fresh produce instead. Children should adopt new lifestyles for 3 to 6 months before having their blood pressure checked again. Continue leading a healthy lifestyle until the child's blood pressure is consistently normal. If it turns out that after 3 months the child's blood pressure starts to stabilize or improve. On the other hand, the doctor can suggest antihypertensive medicine if your child's blood pressure continues to be high. Typically, hypertension medications that are well tolerated by children's bodies come in the form of thiazide diuretic, angiotensin converting enzyme inhibitors, angiotensin II receptor blockers (ARBs), beta blockers, calcium channel blockers. However, each youngster may receive a different combination of hypertension medications. This will be modified based on the child's body's reaction to food and activity, the duration of hypertension, the presence or absence of additional illnesses, and the level of blood pressure. Discuss the type and dosage of medication further with the doctor to determine which is best for the child's needs. Children with hypertension require further screening in addition to routine blood pressure checks to find other cardiovascular illnesses including diabetes mellitus and hyperlipidemia. To lower the risk of complication from childhood hypertension, treatment must be started as soon as it is identified. Thanks for watching Sunbro. Please subscribe, like, comment, comment, and share if you find this helpful. Come again to our next meeting, Sunbro.